someone else that the world has made. Jesus, take from me all the pressure to be someone that you did not create. Help me be me and only see you. Let me decrease and glorify you. Help me, God, help me. I thought my intentions were good. Just act like a Christian should and hope that someone watching would approve and be inspired. But if you're not feeling my show, then how far could I go before all of my accomplishments go down in fire? Just cause of the pressure to be someone else that the church has made. Jesus, take from me all the pressure to be someone that you did not create. Help me be me and only see you. Let me decrease and glorify you. Help me be me and only see you. Let me decrease and glorify you. Help me be me, just like you made me. Only see you and nobody else can. Oh Lord, decrease and glorify you. I just wanna live for you, nobody else but you. I just wanna live for you, nobody else but you. I just wanna live. I just wanna live for you, nobody else but you. I just wanna live. I just wanna live for you, nobody else but you. See, I just wanna live. I just wanna live for you, Jesus. Nobody else but you. Nobody else but you. I just wanna live. No one else. I just wanna live. Nobody else. I just wanna live. Take away all the pressure to be someone that you did not create. Lord, I try so hard to be the best that I could be. It's like every time I take one step, something's right in front of me. Lord, where would I be without about your grace and mercy. Oh, now I have one question, Lord, why? You changed my whole life. Oh, you made my wrongs right. And for the rest of my life, I'll never know why. You did something out of nothing. You did something out of nothing. You spoke and I was so. Well, I'll never know. My life was headed out of control. Somehow I should.
All right, family. John Crawford, say his name. John Crawford, won't you say his name? Michael Brown, say his name. Good morning, family. This is Bishop Swan with you on the spoken word, and as usual, we'll be telling it like it is through cultural idioms and nuances that shape the order, ethos, and chaos of the African American experience. Words have their own vitality. They shape their own consciousness and create their own context. for interpreting social and spiritual reality. The spoken word contains the power to reshape the landscape of society. It is. Let me see, what is it? 9:07. 9:07. We're improving today. I got a little feedback. Let me see if I can fix that. And I'm going to come right back at you.
Tommy Yancey, say his name. 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 Jordan Baker, say his name. Jordan Baker, say his name. Jordan Baker, say his name. Say his name, won't you say his name? I'ma dash y'all say his name. I'ma do the y'all say his name. I'ma do the y'all say his name. I'ma do the y'all say his name. 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 Won't you say his name?
All right. So listen, let me tell y'all what's going on. The radio station is closed during the quarantine period. It was open the last couple of weeks, but for precaution and reasons of safety, they've made the decision to close down until further notice. So I am broadcasting remotely because I know so many of you who listen still want to have us on the air and giving us giving you the information that we give you every single week, and so we're prepared to do that until further notice. So please forgive any glitches and all that kind of stuff. I'm used to being in the studio, and so now I'm remote from the man cave in my house, trying to work it out, and we'll see how it all goes. So there's a different number that you'll be using today. You should see it pinned there on Facebook, 413-337-1867. Type that up on Periscope. Periscope, double tap that screen. Send some hearts up in the air. Let me know where you're chiming in from. Rep your city, rep your town. Somebody type that in the comment section. The telephone number, 413-337-1867. Once again, 413-337-1867. Put that in there in case somebody wants to call in this morning, chime in on the conversation. And we're going to be talking about, well, basically what has inundated the news all over the world. Of course, this wretched pandemic that we are dealing with and continue to deal with. And today I want to talk about really how America botched being prepared for this pandemic. And, there's an interesting article out there about how George W. Bush, when he was president, was on vacation and he was reading a book about the 1918 influenza/Spanish flu pandemic, and he became obsessed with getting America prepared for the next one. And he said that these pandemics come every 100 years, and when the pandemic gets here, is not the time to get ready. It's too late to get ready once it's already here. and he embarked on a program to prepare America. They set aside funds to get quick response on a vaccine. They stockpiled protective equipment, masks, respirators, ventilators, those types of things. Over the years, government decided that his program was no longer a priority, and they stopped it. This was back in 2005. And here we are, 15 years later, in the midst of a devastating pandemic that has taken American lives that we could have been prepared for had they kept going with Bush's program. And so it kind of makes you wonder when people in government tell you that they're looking out for the best interests of the American people when they're really not. And so here we are. So we'll talk about basically how America botched its pandemic plan and how we got to where we are now. All right. So once again, the telephone number to get in on this conversation is 413-337-1867. 413-337-1867. Don't touch that dial. Stay with us. We're going to be right back.
Inglewood. Purple rain falling down on the prince of the coast where the sun shine all year round. Purple haze over landscape, still I hydrate in the lunch line with the smog and clouds. Start me out. This song's in the key of life, and love is in need of more. From Inglewood, barefoot on the cedar floor. If black music is the blood, then my heart has been beating more. Rapidly, happily, I look back on the fiend he should call her son paved the way. Now all eyes on me, cause I'm young, black, and gifted. Nina, all eyes gon' see. If you swung back when faced with a challenge that's meant to break you and balance scales, you ain't average. Now throw your hands on three. Gon' put them up for black magic, black excellence, black habits, this black medicine. Everything black chucks, everything. Everything black hug, black love, everything. Praise black Jesus, play black Moses. Give them flowers while they still give black roses. Everything black tribe, black bride, everything. Everything black pride, black lives, everything. Skin noir, friends noir, here you are, black. Everything you need, better believe you are that. Skin noir, friends noir, here you are, black. Every time they hear this, they gon' say he made an anthem. Life ain't a panda, ain't black and white, it's a canvas. Spike Lee your dreams and Bruce Lee your tantrums. 2-3 that board, then go Michael Jordan, go Samson. Knock down the walls around me, strong and dark and so handsome. Everything around me is shining dark and the time is divine. I found a spark when the clouds leak and the rain fall and I found peace. Black as the concrete, black as the street that's lined with the palm tree. I'm black as the night sky when you broken your radio bacon just don't mean. Black as the bottom of Chuck Taylor's, black on some haters. Black as the burnt rubber hitting donuts in front of the store with 2 months later they got stopped and the cops found a black burner underneath the seat on some Nat Turner. Black as the judge rolled when the case closed, now your life on the back burner. Black magic, black magic, black excellence, black excellence, black habits, this black medicine. Yeah, everything black chucks, everything. Everything black hug, black love, everything. Praise black Jesus, yeah, play black Moses. Give them flowers while they still give black roses. Everything black tribe, black bride, everything. Everything black pride, black lives, everything. Skin noir, friends noir, here you are, black. Everything you need, better believe you are that. Skin noir, friends noir, here you are, black. Everything you need, better believe you are that, yeah. Mira negrito, puro amor pa' mis morenitos. Hice un giro, cambiando idioma. Huele palomas encima de roller coaster calle cerca de la playa, Ocean View. Blacker the berry, the sweeter the juice. We dancing the soca too. Only f with you real to chill with us, build with us, and deal with us. Never pull the trigger aiming at another
Good
man.
morning.
Real hitter still pick up the phone. Hey, smoke what you need. I ain't on this mission alone. Used to dream of really stacking my funds. Now my windows just as black as my gun. I feel divine. It came on time. God never changes, ain't gon' lie. I lost faith and cried, then my faith revived. And as soon as I let go and surrendered to him my talents, this young king took off like go-go gadget. There go that black magic. Black excellence, black habits.
Good morning.
Everything. Good morning. Can you hear me?
I can hear you. How are you?
Now you're perfectly clear.
I'm perfectly clear now. Good,
Yeah,
good.
yeah.
Good morning. How you doing, Senator?
Good. Family safe and healthy. I've got nothing to complain about, but certainly a difficult time for everyone. So
Yeah.
hope everyone listening is safe and somewhere where they can be safe.
So let me ask you a question. Are you quarantining at home, or are you still out in the field working?
So we are working. We're doing what's called informal sessions at the moment. So like we're still moving legislation. So yes, last week, for example, we did an unemployment insurance bill. We did a municipal relief package, but we're doing it remotely. So trying to be a good example and show that work can continue while being distant from each other. So it's mostly been calls and emails. I'm not sure I would use the word quarantine, but certainly following the distancing guidelines as much as I can, and trying to keep in touch with people by phone and email.
So how is this thing specifically affecting residents of Massachusetts? We're hearing about everything across the globe, but we're paying close attention to what's happening right here at home. So we'll talk a little bit about how it's affecting Massachusetts, and then how you see it from a more national perspective. I know there's some restrictions that the governor has put in place. Two cities, Boston and Springfield, have both, Mayor Walsh and Mayor Sarno, now telling folks to wear a mask out in public. And we know there's a shortage of masks, and they're telling folks to make them and all of that. So give us a kind of a synopsis of what's going on here in the Commonwealth.
Yeah, so thanks, Bishop, and good to hear from you, and glad that the remote setup worked. So I'm glad everyone's staying safe. But yeah, I mean, this is a very unique situation in that you really have a global issue that is certainly hitting us very hard locally. So let me just run everyone through just the guidelines and the rules here in Massachusetts. And I would just point out that I do think, unfortunately, Massachusetts already has experienced this in a more intense way than other states, and is likely to see many more cases than other states. Partly it's the proximity to New York, partly it's our own.
Yeah, that tri-state area, New York,
started,
New Jersey, and Connecticut.
Right, though really the whole Northeast, if
Right.
you kind of look at the heat map of where the cases are, it's really from Washington, D.C. metro area up through Boston metro area. Of course, we're right in between that. And here in Western Mass, we have a challenge because we're facing, spread from the New York metro area. There was a big outbreak in the Berkshires, for example. But then also we have one of the first clusters that started all of this was the Biogen Marriott in Boston, the Marriott Long Wharf Hotel in Boston. So people do need to take this very seriously. So just a few of the rules, because we've gotten a lot of questions about this. The governor's order is really a few things. Number one, no gatherings of 10 or more. And this is across the board. You can't have an assembly of people more than 10. And even if you are with other people, even if it's less than 10, it has to be, you really have to, as much as possible, stay 6 feet from each other. And the mask, by the way, does not replace that. So just because you're wearing a mask,
Correct.
Doesn't mean that you can get close to somebody and start hugging them. And, everyone should just please use, caution about that. And then the other piece of this is non-essential businesses
have been asked to either close or, if possible, work remotely. Now, there's no limitation on working remotely, so certainly if you have a business or you work for an employer that allows you to do remote work, that can continue, obviously uninterrupted. But we do know that there's plenty of people, a lot of people that don't have jobs that can be done remotely, and so this is really creating a lot of pain for them. Those are the rules, and of course, schools are closed, restaurants are closed, bars are closed. Anywhere really that people are congregating in large numbers, the exceptions being grocery stores, pharmacies, things like that. But then the other thing I would say is very important. The single most important thing we can all do right now is to stop the spread of the virus. Quite frankly, the economy can't get back to normal. No one can really get back to normal if we're all afraid of getting sick, if we're near each other. So really the most urgent issue in front of us, I do think, and all of us need to work together, is to stop the spread of the virus. But very, very close behind that, is an urgent economic crisis that we're facing. And we need to marshal every resource. And I've been leading in the Senate in the state Senate, our efforts around the economic recovery and response plan. But we need to marshal every resource to make sure that unemployment insurance is working well, that businesses have access to grants and very low interest loans to keep them afloat. Because we have an economic crisis that's now following this health crisis, and the two are linked. We've got to solve the health issue in order to solve the economic issues, but we also need to make sure people are getting help along the way while these shutdowns occur.
Now there's a very real concern with some of the rhetoric around that, with the conversations about opening the country back up. We heard the conversation, of course, that was, it didn't go that way. Talking about having packed churches on Easter and talking about getting sports back up and all of that. And people, have kind of looked at it as badly as folks are hurting economically, with 6.6 million people filing for unemployment. They still see it as kind of callous. Any politicians who are having conversations around, getting things back to normal without it being backed up by what the scientists and the medical professionals say about the spread of the disease.
Exactly. I mean, frankly, you want to give people hope. So we certainly want to be optimistic, and we will get through this. We have to get through it. There's no other choice. And certainly generations have faced greater or certainly equal challenges. But I do think, I agree with you, it's very premature. In fact, I think it's irresponsible to give people a sense that this is going to be over based on any kind of artificial timeline. It's going to be over when the contagion stops and when we've gotten the testing ramped up. I will say Massachusetts, luckily, has been a little bit ahead of the other states with testing capacity. We're, I think, fourth in the nation on per capita testing. Obviously need to do a lot more. But we really can't get back to normal until, number one, everybody gets tested, really. That's what you need, is you need everybody to be able to get very quick tests. And then we have procedures in place to really help treat the illness. This is a brand new illness. We don't yet have a vaccine, of course. There's very few therapeutic medicines that have been proven yet. So until that happens, the only real way we can prevent it from spreading is by staying apart from each other. And I just, my feeling on this, and I'd be curious if listeners have thoughts, but I just think that if we open the country back up and things try to go back to normal prematurely and the cases spike, we're going to be in an even bigger problem.
Yeah, and when you consider there are experts who are really saying that that even when we turn a curve and we see numbers start going back down, there's the potential come the fall that we'll see another spike happen again, and we still won't be at a point where we have a vaccine, because they're talking about up to a year away from producing a vaccine.
Exactly. I mean, and actually a test case of this is people should look at what's happening in China, because China's lockdown makes America's look like, nothing. They literally shut every single thing in the country down for months and months. They're now reopening, and as they reopen, they are seeing now the cases go back up. So, what I think the way I sort of envision this is going to be a tiered process. Number one is we need to do the social distancing. We need to keep people apart so that the healthcare community can catch up to the treatment issues, and that the healthcare community can catch up in terms of treating the people who are sick. That's number one. Number two, we need to create a safety net for people so that they can survive while the economy is shut down. My office, I'm sure you're getting the calls too, Bishop, flooded with calls, people who have lost their jobs, people who don't have food, people who are in very, very desperate situations. So we need to make sure that those people and all families are getting the support so that they can continue to stay in place until the medical community can catch up. Then once that happens, at that point we can begin to slowly reopen things, closely monitor it with testing, and we need a once in a generation, really a historic effort to jumpstart the economy again, get people back to work. And I hope that opportunity can be a chance to do some of the big things we've needed to do for a long time in our society, in our state, in our country, to get more economic opportunity for people. And hopefully this is a wake-up call for people about things that have been lacking in our healthcare system for a long time.
Yeah. The closest thing that I see to this, and I looked at 2009, and then I looked back at 1918, the influenza, Spanish flu pandemic, which is about the closest thing to this that we have, the most devastating on record. And during that time, the nation did employ restrictions on gatherings and social distancing and all of that, the things that we're seeing today. We thought this was unprecedented, but it did happen before in our history. And George Bush read a book in 2005 about the 1918 pandemic and was so intrigued by it that he wanted to get the country prepared for the next pandemic, which he said they come every 100 years. And they instituted a program where they set aside money to be able to rapidly produce vaccines, stockpiling of equipment, respirators, masks, other personal protective equipment. And that program continued for a while until those in government decided it should no longer be a priority. And here we are 15 years later, realizing what Bush was concerned about 15 years ago.
It makes me so angry. I mean, it's a horrific abdication of responsibility, what we've seen on a federal level. I mean, you're right on the 1918 lesson, although frankly, we don't even have to look back 100 years to have seen the warning signs. The H1N1 outbreak in 2009, was a warning sign. SARS outbreak, that started in China and in Hong Kong in 2003 was a warning sign.
MERS was a warning
in 2014. Sign. MERS, exactly. So while none of those were at the scale of this, or were at the scale of 1918, they were nonetheless canaries in the coal mine about our lack of preparation.
Yeah, and they were also in the same family of viruses as this more insidious one.
Right, exactly. They were coronaviruses. So, the fact that the pandemic planning team at the National Security Council at the White House had been disbanded right before this outbreak happened. I mean, the list goes on. But at the moment, what we need to do in our state, at least, is make sure that at least for us in our communities in Springfield, in Western Mass, in Massachusetts, we're doing what we need to do. And I just want to end on this note, which is a hopeful note for people, that I've just been so impressed by the medical community, by people who have really put their own health and safety on the line to take care of our patients at Bay State, at Mercy, at Cooley Dickinson, at Holyoke Hospital. I mean, these people are really heroes. And
I've got a boatload of folks in my congregation who work for Bay State, and so we definitely applaud them.
Yeah, we just need to lift them up and always look for the helpers, right?
Absolutely. Well, Senator, I know you got to go, but thanks for calling in, and man, we'll stay in touch, as we go through this.
Yeah, and just to because I know people are listening. If there are issues, if people have questions, they can, as always. We're working remotely, but the lines are all open. All the calls are still going through. They can reach my office 413-526-6501. Again, that's 526-6501, or eric.lesser@masenate.gov. Or online at Twitter at Eric Lesser, on Facebook at Eric Lesser MA, or senatorlesser.com. We have a form on there too. And people can also check out senatorlesser.com/COVID-19 to get up-to-date information on closures, on meal programs, on unemployment assistance, on, really as much as possible. We're trying to put all the different state resources in one place for people.
All right. Thank you so much.
All right. Thanks, Bishop. Stay safe.
You too. Take care.
Bye-bye. Bye-bye.
413-337-1867. 413-337-1867 is the number if you want to chime in. We're working this remotely. The radio station itself has closed for safety reasons, and of course we understand exactly why. So we're not sweating that because we want to be safe. But we still want to bring you the information that we bring you every week. So let me tell you what happened in 2005. So in 2005. President George Bush was on vacation in Crawford, Texas, at his ranch, and he began flipping through. It was an advanced reading copy of a new book about the 1918 flu pandemic. As he began to flip through it, he couldn't put the book down, and so when he went back to Washington, he called his top Homeland Security advisor into the Oval Office. He gave her a synopsis of the book and what historian John M. Barry's The Great Influenza told about the chilling tale of this plague, this virus that at that time would kill more people than the outbreak of any other disease in human history. And he told her that she's got to read the book. He said that this happens every 100 years and that we needed a national strategy to be able to deal with it. Out of that conversation that he had was born the nation's most comprehensive pandemic plan. It was really a playbook. It included diagrams for a global early warning system. It included funding to develop new rapid vaccine technology. It included a robust national stockpile of critical supplies, face masks, which we don't have today, ventilators, protective equipment. And the effort was intense. And it took place over the course of 3 years. It included exercises where cabinet officials gamed out what their responses would be in case of a devastating pandemic. But the program was not sustained. As usual, priorities shift in government. And many times, if they don't see the immediate need, if they don't see something that will give them favor immediately with their constituents, then priorities shift to something else. But here we are now, 15 years later, with a need for a robust plan. And so, you know, when you think about things, you plan for the future, not for right now. And that's, I think, my friends, part of the problem living in a hyper-individualistic society where instant gratification is the order of the day. Whatever's going to get me results right now